Welcome to the Ovation Show, where we're discussing the healthcare crisis in America, and we're bringing partners, colleagues, clients, and business owners together to discuss solutions and innovations that are bringing a higher quality of care to employees and consumers while reducing out-of-pocket costs. We're also reducing employer costs and giving them more transparency and control with their healthcare. Today, we're live in the Work Innovator studio, where Work Innovators is amplifying the voice of business. Today, we're going to go into kind of a little bit about pharmacy. If anyone's read my book or look at the book, Life and Death Decisions in the C-Suite, I wrote the chapter on Pbms and transparency in pharmacy, but also just the escalating cost of drugs and really how people even stop taking drugs or they ration out their drugs, and it can cause death. In fact, there's a story in there about a young guy that couldn't afford his diabetes medication. In the end, it killed him. And so we are seeing solutions now of different companies that are really making drugs affordable again, kind of taking out the middleman and making it cost effective to keep drugs, whether it's through a health plan or as a consumer just on your own. So today I brought in two guys from Austin, Texas, a couple Texans, or Waco actually, sorry. We have Mark McCormick and Zach Zeller from ScriptCo. And first of all, excited to have you here.
Yeah, thanks for having us.
Thanks for having us.
Heath Oakes turned around and told me, he's like, you got to meet these guys. You got to meet these guys. And he's been a longtime friend. Yeah. So I was like, okay, I'll look at him, see what it is. Is it another PBM? What is it? And then of course you and I talked, Zach, and I was like blown away.
Thank you.
And we were supposed to be here last week, and then you canceled on me for good reason. You guys all of a sudden are all over the news.
Right.
And so I turned on, in fact, I was watching Fox that morning. I got really excited. I turned on, and there comes ScriptCo. I'm like, I'm looking at it. I'm like, quiet for a minute. I got to hear this. And I'm like, I know those guys. And he's like, you know them? They're on TV. Cool. So, all right. So let's just go into what is ScriptCo?
ScriptCo is the first membership-based wholesale pharmacy in America. So what does that mean, right? That's people are like, what does membership-based mean? Well, ultimately, we created the first pharmacy in America that's, number one, transparently disclosing the actual cost of a drug, and number two, selling it at that cost. So we make no money from medications. Our only revenue comes from memberships. And so, our patient population we're focused on is really the 79 million Americans on 3 or more maintenance meds. That's just where we beat traditional insurance, GoodRx, cost plus drugs, fill in the blank. We beat them all.
So how did you guys come up with the idea of like creating a pharmacy?
Yeah, well, Mark and I own some pharmacies here in Texas, traditional retail-based pharmacies. And through a series of unique events, we started comparing the patient out-of-pocket expense for same drug, same day supply versus the actual wholesale cost. And what we found was about 80% of the time, the actual wholesale cost was significantly less than the actual copay. And we're like, there's a business in there.
So you're an actual pharmacy. So you're filling the prescriptions, you're mailing them out. Versus like GoodRx, I can get a coupon, get a discount, but I still am going to whatever pharmacy I choose based on what they show as maybe being the cheapest one, CVX, Walgreens, whatever. So you're actually filling the prescriptions, sending them out. So let's kind of walk through that process of, I go to you, I have a prescription, I go on your website and I order the prescription. What process is that for the person?
This is the operational guru you're talking about.
Yeah, I think it's, one step before that some people get confused on Facebook or after a news release. You don't have to become a member before you actually go see how much you would pay with ScriptCo on your generic. So there's a quote tool on the homepage that it literally just, you don't have to give any information to us. It's literally type in your generic drug, the quantity, the strength, the form, and then it'll give you a quote. And what's different about us versus like all these other websites like Cost Plus and GoodRx from a user experience is that you can quote up to, I think, 15 meds at one time. So you don't have to go quote a med and then write down the what you would pay, go quote another med, write it down. You can enter 15 meds, hit quote, and then you'll see your total in each med. Versus like GoodRx, you have to go to their landing page for each drug. So that's the first step, is that you can quote before ever becoming a member if it works for you.
And do the simple math equation, right? Yeah. It's like, my cost is cost is $10 as a ScriptCo member, and I pay $50 right now, right? And so then you can see, paying the $140 a year makes sense. Right?
Well, you said about being able to have it all at once, because I hadn't played with that on the website yet. I mean, I assumed it was one at a time, because if I go to any of the other websites, I put in one, search it, write it down, write down what the cost is, what my cost is going to be, what the savings is, and I got to calculate it. So if I'm on 6 medications, I'm adding them up, figuring it out. But if you do that for me, now I can see
one number.
Yeah, one number. Hey, here's my total cost. Here's my savings versus what I was looking at before, and make an easier decision.
Yeah, it breaks it down for each drug, but then it totals it for you. So there is no calculation. It is our savings calculator.
Yeah.
So looking at, you talk about, wholesale price. And so let's look at GoodRx. I mean, they're getting these deep discounts. The prices are pretty low when you compare it to what I get the pharmacy, or even when we look at PBM stuff, we see the cost. And we do that with our corporate clients. We look at it and say, hey, this drug is $100. Well, using GoodRx is only $70. Why don't you have your employee go to GoodRx? It saves everybody money, and we work that process. But if I'm looking at that wholesale price, why is there such a difference between GoodRx, Cost Plus, you guys? I mean, if it's all, everyone says it's kind of the wholesale price. I mean,
they're still operating in the PBM ecosystem, GoodRx is, right? So they're going through the switch. They're negotiating with PBMs on rates and
I think it's actually still Optum.
Yeah.
So Optum still even though that GoodRx is a coupon card,
right?
Optum and GoodRx are making money off of each transaction that's used. So Optum is the back end processor for GoodRx coupon cards.
Well, I remember we did go back years ago with new benefits, and here in town we had a discount card, the Ovation Care card we did. And those all had RX discount programs in there. And you talk about making money on the discounts. Yeah, we would make 25 cents or 50 cents on every drug filled with that card. So I mean, we're making money. Whoever's behind that discount card is making money as well. So that makes sense. I mean, so filling the drug, you guys fill it, you mail it out to the employee or to the consumer.
That's right.
Do you do it on an ongoing basis? So if I'm taking a drug every month, you're going to automatically send it? You send 90-day supplies, 30-day supplies? 90-day
supplies are about 78% of our...
Yeah, more than that. Yeah, so we got sort of sidetracked, but they fill out a join form online, and then they pick their membership. And so once they do that, they have an account. We have them in our pharmacy system, so it's automated. And then they get prescriptions sent to ScriptCo, just like they would get prescriptions sent to CVS. If the doctor wants to electronically fax it, they can fax it. If they want to call it in, they call it in.
E-scribe it.
Or they can e-scribe it. Electronically e-scribe out of their EMR software. And then lastly, like if the patient does have a written prescription, they can mail it to us. We have a few patients that do that for whatever reason. And obviously it's slower. But once we get the prescription, we process it. That just means that the tech processes the script in our pharmacy software. The pharmacist reviews it, verifies it. And then we put in a pending payment queue, which basically pings the patient via text saying, hey, log into your ScriptCo. You have meds ready for payment, review, and check out if you want to. And then once they check out, it tells our pharmacy system, hey, fill this med. You fill it, ship it.
And so we're dispensing whatever the physician wrote, right? So if the physician writes a 90-day supply, back to the initial question, the 90-day supply gets dispensed. And our goal is to always dispense 90-day supplies, right? Because selfishly, it's easier for us, right? Because then you're only dispensing 4 times a year versus 12 times a year.
I was going to say, shipping costs, et cetera, all of that.
Exactly. And it's easier for the patient to only have to deal with getting refills 4 times a year. We notify patients 2 weeks prior to them needing a refill. So we don't do auto refill. We do a notification that says, hey, your prescriptions are about to be due for refill. Do you want to get them refilled? And then we can send a refill request to the physician's office.
Okay.
It's actually funny, people bring it up, and to really, for ScriptCo to operate the way that we operate, where we don't limit the patient to a certain amount of drugs. Like all online pharmacies, doesn't matter who they are, there's not one out there that's doing what we're doing, and that's 2 things, like displaying that cost price and giving it to them at cost with the membership, but also we're saying, we don't have a list of drugs because if it's not on our quote calculator, it's a generic and it's a non-controlled, we'll add it to it. But we have probably over 95% of the generics out there on the quote calculator. So in that example, we can never do auto refill because a patient would basically be saying, yes, charge my credit card for any prescriptions that come in. But wonder if a script comes in. I mean, we have patients that get these specialty meds sent in, and they're $12,000. Well, we put in their queue if they want to pay $12,000. But wonder if a patient said, yeah, auto pay me any script that comes in. That's why we can never do auto pay, but we make it as easy on the patient as possible in the sense of they can pay online, they get notified via text, they can request online, But at the same time, they can call in and a customer service rep can check them out over the phone, go over the meds with them. So it's very accessible.
So, I mean, it's just very much like with a health plan, they urge you to use mail order.
Mm-hmm.
So it's the same thing where we're calling it in, the doctor's sending it in, and they're filling out 90 days, and we're paying triple the copay. In your case, it'd just be 3 times the cost, et cetera, for those 3 months. So looking at costs, and we'll go into some specifics on that in a little bit, and some examples. So you mentioned your membership fee. So we look at, like, GoodRx has no membership fee, free, get a coupon, or you can buy their gold for whatever it is, $20 or $10 a month or whatever. And that's some added savings. And then you have like Cost Plus, where it doesn't have a membership fee, but they're adding commissions and other things on top of it, which
and limited amount of drugs.
And we'll go over that. So we'll go over that too. But so talk about your membership fee and how that works, and even what is the cost in that?
Yeah. It's really simple. It's $140 for 12 months, or it's $50 for 3 months.
Okay.
It's that simple. And then as a member, whether you're on one med or, like, we have some
20.
members that are on 20 meds, right? They're getting all 20 of those meds at pass-through pricing. So we don't make 1 penny from the med. It only comes from the membership.
So I think that's where that's.
And they get free shipping.
That's awesome.
Free shipping 4 packages per year. So if you're on a quarterly membership every 3 months, then you get 1 free shipment every membership renewal.
Okay.
And if you're on a yearly, you get 4. So you won't pay for shipping.
We're just trying to create some parallels between us and the consumer, right? Where, hey, if you help make our lives easier, we help save you money, right? So if you get 90-day supplies every time, you never pay for shipping.
I like that, just a flat membership fee too, because when we look at fiduciary PBMs, we walk into clients or prospects and they have one of the big 3 PBMs. You got Optum, Express Scripts, and CVS Caremark. They charge all kinds of hidden fees, and there's all kinds of money that comes back to them. So when we look at a fiduciary PBM, it's all 100% pass through. So they're not making any money anywhere else other than their fee. And that's the same as you. You're just taking the membership fee only, and you're doing 100% pass through, which is what the cost is of the drug, which I think is impressive in itself.
Thank you. It creates alignment. That's what it does ultimately, right? You're aligning yourself with, hey, if we can't create value for you, then we shouldn't get paid, right? Well, the only way we create value is by bringing costs down, and then it makes sense for someone to pay $140 a year or $50 a quarter to become a member.
Yep.
Because the math equation works.
Well, I think it's a math equation, and we tell people everything's about math, and so look at it. And I think doing it, what you said about the spreadsheet, being able to look at, here's all my drugs, what's my savings. So if I look at it and say, well, look, I'm going to save $350 over where I was getting it before, it makes sense to pay $140 because I just saved an extra $200.
Yeah.
But if I have one drug and it's going to save me $20, maybe I don't want to do it then, and go a different route.
Unless it's $20 a month.
$20 a month, then it's a different story.
Yeah. And the user experience is incredible. If, check out our Google reviews. Like, they really do a good job of articulating what our members experience. It's very simple. I mean, we have literally 90-year-old grandmas on our platform who are doing it from beginning to end, right? Because it's so simple. It's very fast. We ship the med the same day you pay for it, about 90% of the time, even higher than that, probably 95% of the time. So you're getting your meds quick. There's no delay. You can call the pharmacy anytime and talk to a pharmacist, talk to a pharmacy tech, talk to customer service. It's people love the user experience, and that's why we're so crazy about those two things, is transparency and user experience, because someone else will do this at some point, right?
Yep.
And the reason we priced it so low is because no one's really going to come in and be able to say, oh, well, I can just take the market because they priced it at $400 a year, right?
Yep.
And we know our average member savings is right at $1,000 a year after they pay for their membership and their meds. Our average member's on 3.8 meds. So we could charge more, but we really wanted to build something that kind of removes all the barriers, right?
Yep.
Not create barriers. So.
And also, one thing, we actually get comments from some pharmacist owners of pharmacies, right? That they're a pharmacist, they own a pharmacy, and they're like, they're lying to you. This ain't real. They're getting drugs from, non-approved wholesalers. I mean, we're a U.S. pharmacy. We have to get drugs from wholesalers licensed in the U.S., right, just like every other pharmacy. But one thing that does come up is, and I sort of applaud them for looking into this, but one thing that they say is that, ScriptCo is making money. They're lying to you. They're making money on the membership, but they're also getting a rebate from manufacturers. We have no rebates. We get no rebates at all, because the business model that ScriptCo is trying to project is the lowest cost for the meds will get us more members. So the rebates, the rebate pricing that we went over before we opened ScriptCo with a major wholesaler, we were like, this isn't even cheaper than GoodRx. Like, no, we can't have a rebate. We want the lowest cost possible. So we have never gotten a rebate. We will never get a rebate because we want the lowest cost.
And you really fit in with the model that myself and my colleagues, even the Next Gen Mastermind, we talk about. That's that full transparency, pass through. Even with the Pbms we deal with for, group health plans, we make sure that, the rebates, it all goes back to the employer. Any third-party dollars all go back straight to the employer to go back to their bottom line. No one should be making those money on that. And I think it's great that you guys are just giving that up as well. Yeah. Saying, we don't need that, and we're going to pass the savings to. So let's talk about savings because, I did my research, and I've got some information, Zach, that you had sent me. But I love this. We can talk about more drugs, but I love this one because, I look at something. We have albendazole. I don't know what it's for. I looked it up, but I don't remember now. But, look at this drug. I went on GoodRx and it's $35.29. Okay.
For how many? Or is it, do you know?
That
it's probably a 30-day
supply. Yeah, it's 30-day supply.
Right.
I haven't looked at my notes. So $35.29 is GoodRx. So I get a coupon and go to the pharmacy, and it lists on GoodRx.
Yeah, different pharmacies.
It's like several $1,000s for the drug. $35.29 with GoodRx. And we won't go into how that pricing works. That's ridiculous.
Yeah, that can take the whole show.
Okay, 4,000. How do you go from 4,000 to 35?
And that was the lowest cost pharmacy on GoodRx, right? Because there's different prices. So you took the lowest price from GoodRx.
I took the lowest price from GoodRx,
which is like AGD or Kroger's.
And we talk about that. We'll just touch on that for a minute. It's really interesting to see when you go on GoodRx. I always say, you look at it, here's CVS at $35.29, Walgreens $42. This Tom Thumb is 110, and see the price differences between just a pharmacy. And you think it's this, it's the same drug. And the pharmacies are across the street from each other. How can they have a different price for that same drug? And that's always interesting to see. But I did take the lowest cost of $35.29. Then I go over to Cuban Cost Plus Drugs, which they've launched this year, or was it this year? Last quarter?
This year. It was like a month ago.
Yeah, a month ago. So they have the same drug for $33. Okay, savings are getting a little bit better, $2 down. And then I go on ScriptCo and it's $5.60. I mean, that is a huge, huge difference. I mean, we're talking about a $30 savings a month. So that one drug, if I was taking it, $360 savings a year, if that was my only drug, makes total sense to go with ScriptCo. But what I like is what you said, the membership fee, that's at $560. I looked at Cost Plus, and we'll touch, they have their 15% markup. They have let's see, what else do they have?
$3 dispensing fee and a $5
pharmacy labor, shipping, and it comes out to $33. But the main thing I want to point on is their manufacturing cost is $26.08. So talk about that.
It's because it's not manufacturing cost.
Yeah.
So that's what I want to know. So you guys are getting a wholesale cost of $560. Their manufacturing cost of $26.08. What does that mean? What's that difference?
If you look on their website, I'll let him talk in a minute. If you look on their website, they say manufacturing cost. Yeah. And then there's some section on there that I think Cuban had some sort of letter or notice or something. And
it says all of their medications are filled by TruePill.
Yeah, so it's basically, think about it like this. TruePill is a pharmacy that fills for different platforms, online platforms. Is that the one that Amazon
bought or somebody?
No, they bought...
They bought PillPack.
PillPack, that's one. Okay.
Yeah, so PillPack was a major pharmacy. It still is, obviously. But they were billing insurance, and they were their own thing. They were their own technology. They came out with that PillPack packages. TruePill is a pharmacy that fills for other online platforms that are not real pharmacies, that just market drugs, and then the script gets... Yeah.
Okay.
They take the orders, and then it's branded as Mark Cuban's Cost Plus Drugs.
So I could go to TruePill and create Dan Labroad cost.
Yeah, you could.
Interesting.
So it's not the manufacturing cost. It's the cost that TruePill is charging Cost Plus Drugs plus 15%. So what is TruePill buying those drugs for? I don't know. I guarantee you that I'm not going to guarantee you, but they have to be marking up those drugs.
Right.
So that's a simple answer.
Yeah.
So they're making their money, and then they're just passing, okay, we're adding on whatever percentage we want. Now we'll sell it to Mark Cuban, and then he adds on his percentage. And then then all his fees, of course, he's covering his labor with the pharmacy labor and the shipping.
But he doesn't have any labor. He's literally a website. Like Cost Plus Drugs is a website. It is not a pharmacy.
TruePill is filling everything.
TruePill is doing 100% of the work. Like like literally Cost Plus Drugs is a website. It's not a pharmacy.
Oh, wow.
It has
No
nothing
customer
to do with
service.
pharmacy. You can't even you have to call True Pill.
Yeah,
You
there's no
can't even
phone.
call Cost Plus Drugs. That's why they keep deleting all the comments on Twitter.
Just
Because
say, I mean,
people are blowing them up.
you have to pick on Mark Cuban because I mean I like the guy, but
Yeah.
that's like a big smoke and mirrors game to me.
It's
It's not my words.
It's it's funny that like we were just on Fox News, right?
Right,
That's
yeah.
why I missed the show last week. Well, Steve Noviello, the consumer reporter, said he tried to contact them multiple times and they wouldn't return his phone calls. And not to demean or say that someone's lying, but I think that it's complicated for them because they are representing that it's the manufacturer cost. And how do you get on camera? And if that comes up, what do you say?
Yeah.
Because we signed our first manufacturer deal 4 months ago, and the price drop was significant over the wholesale cost, and it's not even comparable to what they're representing the manufacturer cost is,
Oh, wow.
right? So it's interesting.
Yeah, and it's really funny because they're portraying the manufacturing cost, where no, it's just a cost from True Pill plus this, plus that, plus this. Well, we're saying it's the wholesale cost, and I think you touched on it earlier, but the wholesale cost just means the same price that we buy it for,
Right, it's
which
what
is the
you're
same
paying.
thing that Cuban is doing. It's the same price they buy it for. The same price that True Pill is billing them. But if we buy it from a wholesaler, we sell it to the patient at that cost. If we buy it from a manufacturer, we sell it to that patient at that cost. So it doesn't matter where we buy it from. We're not marking it up. We're not getting a
great point.
rebate. We're passing it through.
Yeah.
They are limited. They can only dispense these amount of drugs right now, and it's
120.
for the price that True Pill says you're going to pay.
So if you're back and if you didn't actually have a pharmacy with, your warehouse, your storage,
Yeah.
and you were buying True Pill, you'd have this. Let's just assume you'd have the same cost as
Yeah.
Cuban.
Yeah, and we wouldn't. Well, we
We
probably
have a limited formulary,
Yeah,
too,
right,
right?
yeah.
And we don't have a formulary.
Yeah, you mentioned the formulary size. So I mean, I think he's got 120 drugs.
Yeah,
something
something
on
like
his.
that.
How many?
Ballpark. Yeah, it's like, I think it was 121 or 119.
And I know you guys said you have about 95% of all generics. How many is
No,
that?
so
So we have 100% of all generics.
Oh,
We
okay.
quote about 95%
on the
Oh,
quote.
okay.
on the quote tool. But we literally, if someone is going to buy the medication and send in the prescription, we will source it, right?
Okay.
The only thing we don't source are controlled substances.
Right.
So
Mhm.
testosterone, Oxycontin, hydrocodone, Adderall, all those controlled substances. But we literally, if you send in a prescription and it's not a controlled substance
You'll have the
and
opportunity
you want to pay for it,
Yeah.
we will
You'll go get it.
get it if it's on the shelf. We warehouse right now about 1,200 different medications.
Okay, that's what I was wondering.
But the nice thing about wholesalers and manufacturers is when you buy it, they ship it overnight. So if we don't have it in inventory, it shows up the next day, we ship it the next day.
That was my next question: is how long does it take you to get a
Yeah.
drug if I send it
Yeah.
in? So
I mean, listen, we've built something that is so awesome, right? It is incredible. And we just get it done. And that's why our Google reviews are the way they are.
Yep.
And Mark is an operational genius and just has synced everything up so flawlessly from the join button all the way through a tracking number hitting a member inbox. I mean, there's Google reviews on there where people send in a prescription or a doctor send in a prescription at 10 a.m. and by 12 o'clock, the med's on its way.
oh wow,
Tracking number in their inbox, right?
Mhm.
Like we're just crushing it from an operational perspective. And we always will, because the way it's been set up, we've been able to remove all of the barriers around time constraints because we don't answer to a formulary. We don't answer
Third
to a
party.
day supply limitation. We answer to no one, right? But the State Board of Pharmacy. So we follow all the State Boards of Pharmacy's rules and regulations, and you can fill a prescription in 3 minutes beginning to end.
Oh, I love it. I mean, it's exciting to see this because, again, PBMs and pharmacies become kind of a little passion of mine
Yeah.
the last couple of years. I dig more into it and we see what we're doing on the employer side.
Yeah.
But even now, when I look at employees, we talk about this a lot of times is, you have a copay. Well, a lot of times the drug is going to be less than the copay. So pay that amount. Well, if you're going to pay the actual amount of it, check and see if it's cheaper somewhere else.
Mm-hmm.
And we're getting even the TPAs, third-party administrators, and to now, if I go buy it at GoToRx, if I send my receipt in, we can actually apply it towards my deductible. So I'm not losing the little advantage that is of buying it through the plan. But that reduced cost really helps the employers. But as the consumer, that's why I wanted you guys on because, this can be used in an employer group, but it just overall helps the consumer, everyone out there,
100%.
these skyrocketing drug prices.
Mm-hmm.
And you're getting all the drugs from manufacturers or wholesalers
Mm-hmm.
in the country.
Yep.
Okay, because I know we do some stuff with script sourcing where we bring in a lot of meds from out of the country.
Those are brand only meds.
Yeah, brand only. So we're getting it from UK or Canada typically.
Yeah.
And I wouldn't say we buy from wholesalers and all the wholesalers are here in the U.S. We buy from a manufacturer that manufactures overseas, but they're licensed to sell here in the U.S. They have a warehouse here.
Yeah, and the reality is over 70% of the medications that Americans take are manufactured out of the country, right?
Yeah.
And whether you're getting it from CVS, Walgreens. The thing is to remember, like everyone knows cars, right? So you know Chevy, you know Dodge, you know Mercedes, you know Lamborghini, you know Ferrari.
Yep.
It's the exact same thing in the generic space. It's Lupin, it's Dr. Reddy's, it's Teva. They're all the same manufacturers. Every pharmacy is sourcing the same manufacturer because they all have their lanes to a certain extent that they stay in. It's not like one manufacturer makes every drug. It doesn't exist at all, right? So everyone's buying their drugs from wherever they can get the cheapest manufacturer cost if they care about that, right?
Right.
If they don't, and there's a huge reason not to, AWP, and there's a lot that goes into that. That's a whole nother show. But, it's not like there's 100 different generic manufacturers and you can go to this bad one, that makes less effective ingredients.
What's interesting, we had we were using script sourcing. We were sourcing a drug from the UK. And so the employee had said, well, this is coming from, Sweden. Mm-hmm. And I'm like, yeah, that's going to be shipped to you directly from Sweden. It's where it's coming from. But look at the cost savings, blah, blah, blah. And he said, yeah, but I don't know. It's coming from Sweden. Well, that's what's manufactured. And I said, well, go look at the box you have. Only because I knew this already on this one. I go look at the box of the one you currently have. It looks up and it's like manufactured in Sweden.
He's like, okay, I feel
it's
better
the same drug. It's coming from the same place. The only difference is it's coming directly from there.
Yeah.
From a pharmacy in Sweden somewhere where they're getting it cheaper and less cost, and we're just transferring over to you. So, you guys are getting rid of that middleman. You guys are getting it at the so manufacturing and wholesale.
Two separate.
Right. So explain that difference.
Yeah. So the way it traditionally works in the pharmacy space is probably 99+% of the time, pharmacies buy from a wholesaler, right? Because manufacturers really don't distribute.
The manufacturer being something like GlaxoSmithKline or
Teva, Dr. Reddy's. So Glaxo, I don't know which. I don't think any brand like Pfizer or Glaxo. I don't think they have generic lines. They're focused on
most
brand
of the time
only.
they don't.
The brand only.
So when you talk about generic meds, it's typically generic manufacturer. I don't know how many brand only manufacturers also manufacture generics. Okay. Like I don't think Pfizer does. I don't think Glaxo does.
I didn't know any of that. I had never heard of any of those companies either.
I don't think any of them do. If you go and start looking up generic manufacturers, you're not going to see the Glaxos and the Pfizers.
Because they're concentrated on R&D, coming out with a new drug.
Right, new drugs that they can make more money on and the high cost drugs.
Generics manufacturers are concentrated on having this huge
volume
scale and keep scaling, being like, hey, this drug's going generic in the next 2 years. Are we ready? Do we have the raw ingredients, purchasing power, contracts, that sort of thing? So when it does go generic, they start making it be the first to market. And it's funny, the way that it works, like there's some drugs that are brand, like Bistolic was brand until 3 or 4 months ago. It's a heart medication, and it went generic, and it went from like being around $280 cost for a 30-day supply of the Bistolic. When the generic came out, it was like day one it was $44, and by day 30 everybody was pricing the Bistolic generic like $15. That's how fast it drops when it goes generic. The generic manufacturers want to be ready to make that big hit, and then it goes down even further.
And they're still making the margin they need, right? And that's so 99% of pharmacies are buying from the wholesalers, McKesson's, AmerisourceBergen's, Cardinal, fill in the blank, right? Those are the big three, right? I think between the three of them, they do over $1 billion a day.
Wow.
McKesson was like 200 and something billion last year in revenue. AmerisourceBergen was like 126 billion, and then Cardinal was like 100 and something billion also. So there's margin there, right?
Yeah.
And we saw it when we signed our first manufacturer deal. Saw a significant drop, right? And so manufacturers traditionally have not sold to the pharmacy because most pharmacies don't have the volume at one location for them to logistically chase that problem to solve, right? So they've always sold to the wholesaler, and the wholesaler distributes to each individual pharmacy, right? So our goal is to find the lowest cost always for our consumer, for our member.
So how many scripts are you guys filling a month now?
We fill about 200 a day.
Yeah, so
150.
like 4,000, 5,000.
Okay.
Yeah.
And just ramping up and going more and more.
Uh-huh.
Yeah, I mean, the last year we raised some money back in October of 2020,
Okay.
and Mark's been underwater since then, getting everything automated, from robotic fulfillment in the pharmacy, conveyor belts, all the computers, all the scales, literally building out the infrastructure, getting us licensed in all 50 states, tying all of our software together with APIs. And so I think you wrapped that up in like late November.
Yeah, it was the first of the year. Oh, you're talking about, yeah.
Yeah, so now from an operational perspective, we can literally scale, and the only thing we have to do to scale is hire additional team members and let people know we exist, right? And we were afraid to scale too rapidly without having everything tied up with a nice little neat bow.
Yeah.
Right? Because if you happen to hit a grand slam with an employer, with an association, right? That's one of those big step growth changes that can happen. You go from being awesome to having terrible customer service and not fulfilling meds quick enough and all that. And so we wanted to make sure we always stayed way ahead of that, right? And so we really haven't focused on growth until now, right? Now we're like, hey, we can go from where we're at now to 200,000 members. Obviously, there's going to be some growing pains, but really without changing anything operationally.
Well, I'm looking forward to figure out how we can work this into the employer groups. And of course, we'll take it to my partners in the mastermind and then see how we can really push this out. Because I think, again, the cost savings is there, and make it work within the groups. And then on a consumer level, I mean, you guys are just that's just going to keep going.
Mm-hmm.
I mean, especially you had so much publicity last week. All over the news, and I thought it was just local, and then I realized it was national.
Well, yeah, it was local in different cities.
Yeah, it was regional in 10 cities.
Yeah.
Okay.
So it was like Detroit, Chicago, Tampa, Orlando, Dallas. I can't remember all of them.
Yeah.
Your server didn't go down after everyone saw it and started looking you up.
It actually did for 1 second.
It did.
It was like 10 or 15 seconds.
Yeah.
Okay.
It timed out. But we've had it go down a lot before.
When we were on the Today Show, it crashed for 13 hours.
That's awesome.
Yeah.
When were we on the Today Show? When we were on the Today Show? It was awesome. We were on the Today Show.
It was 2021.
Okay, it was last year.
April or May.
Yeah.
It was a great interview. I mean, I thought Steve Noviello did a great job. In fact, I reached out to him right afterwards, said, hey, they're coming on the show next week. Do you want to come out? And he said he really couldn't because we were focusing just on you guys. And he's more about, looking at, I guess, across the board competitors and so on. He didn't want to be one-sided, I guess.
Yeah.
But yeah, it was great seeing you on TV, and it was a lot of fun.
Thank you.
Yeah.
It's fun.
But I took some pictures of showing the cost of the drugs. But I like the comparisons that we did, showing that cost difference. So what I don't know, what's one of the biggest differences you see? Think of a drug, biggest cost difference you see between.
Yeah, we get asked this. We get asked this all the time.
We got a lot of drugs, but
and it's hard because there's people that.
Well, you know this better than anybody. Every single PBM plan has a different copay.
Yeah.
And I mean, it can be drastic, right? From plan to plan for same drug. You can, like Gleevec, right? Like Gleevec, it's a drug for cancer.
Mm-hmm.
And like there for a while, CVS and Walgreens, like the lowest cost you could get there was like $2,800. Well, it's $17 with us, right? Like you literally, I think the lowest cost was like $450 on GoodRx.
Yeah, I don't remember. It was high. I think it was higher.
It was
than that.
very high. But like that's a perfect example, right? There's these outliers, but then overall, the overarching thing is every single prescription drug plan has its own formulary, has its own patient out of pocket, has its own day supply limitations, has its own prior authorizations, and so it's really hard to pinpoint. Hey, if you're on this drug. Even if you have insurance, right?
Yep.
We're going to save money for you because it just, unfortunately, doesn't work that way. But we do know that if you are on 3 or more maintenance meds, the likelihood of us saving you money is well over 80%.
Oh, wow.
I mean, over your insurance copay.
Are you dealing with insurance, or it's just all cash pay?
No, we stay completely out of the insurance.
No, I think it's smart.
Yeah.
I was just
the main reason to do that is I was going to bring up this other topic, but the main reason we do that is if you have some sort of insurance contract, commercial and possibly Medicare Part D, you can't bill lower than what you're going to bill them. So you couldn't charge a cash price to a patient lower than what you're going to bill them. So then, like, if we're billing somebody a penny for a pill, and then we bill insurance and they only pay us 80% of a penny, we wouldn't give it, so we'd be losing money on the drugs.
Yeah,
that's a little bit of a moat for ScriptCo ultimately, right?
To stay out of it.
If you're operating the insurance ecosystem, you're never going to be able to do what we do. So CVS, Walgreens, HEB, they'll never be able to touch us from a cost perspective.
Well, like this is, I mean, I love that. I think that's the best way to do it. And I think now I'm thinking about the employer side of stuff. We can build in, we tell employers, have your employees look at insurance costs, direct costs, use GoToRx, and the employee should go to where it's cheaper. Now we just have to add in, hey, check ScriptCo too. And if we really start finding these drugs are cheaper at ScriptCo, then how does the employer incentivize the employee to go over there and use it? Right. And I think that's just another avenue. But I know in our employee benefit books now, I think I'm going to start putting in just like we did with GoToRx, we'll change over to ScriptCo now.
Yeah.
Because I think that the savings, I mean, it's apparent in all the samples I ran, the savings. I mean, it's drastic. I think overall, I mean, GoToRx $40, Cuban $17, ScriptCo $10. I mean, the savings was all the way down was very similar to that, 50, 60, 70% savings.
Yeah. I mean, it's tough to beat at cost. Like, how do you beat it? It's like you can't beat that. The only thing that comes into factor is like, does it save you at least 140? Right?
Yep.
And so if it saves you at least 140, which we know it does, again, a very high percentage of the time. Like an example, my wife was taking and still is taking a drug called Relpax. Through our insurance, we were paying $42 per pill. The actual cost of that drug's $2.99 per pill.
Well, it's cheaper than that now.
It went down. It's gone down to like $1.30. So she gets all her Relpax, and they would only let her have 6 pills per month. So if she had more than 6 migraines, it went to like $110 per pill.
I just did a group, so it's a small group. We were redoing their insurance, and we saved a lot of money on their insurance. But there was actually the owner of the company, and we were going through his drugs last week as we did all this. And there was 2 that were on your site that he's actually going to get from you guys.
Oh, really?
Because it was such a significant. He was
How
paying,
much? Do you remember?
I think he was paying something like 120, 140 a month, and it's like 30 on yours.
Really?
And he was just blown away. He's like, and he's not worried about costs. He's got plenty of money to afford away, but he said that something I'm going to be on forever. My wife's taking drugs.
Yeah.
And the cost savings was immense. And so it was awesome.
And get it shipped to your door. If he was going to, CVS or Walgreens, save money and just not have to go deal with the pharmacy anymore or insurance.
And the other thing I think it's important to note is the reason mail order pharmacy has never taken off is because most of the time it's very clunky. Like mail order pharmacies do not have a good rap.
Yep.
It's a huge time vampire. They can't get a hold of anybody. Their meds show up 2 weeks late, right? That was like our thought process was like, hey, how do you not only save people money, but also start turning the tide of mail order pharmacy? There's no reason. Why would you want to go somewhere and burn your valuable time, right? What's our most limited resource? It's time. That's why Amazon is so huge, because what do? They save you time, right? And it's convenient. Well, why not save money and save time and get your medications delivered to your door?
I'm thinking too, one of the barriers I would always think is somebody's going to say, well, I don't know if I want to pay $140 a year. But from an employer side, if I'm an employer and I'm going to save money on drugs, I can do the cost analysis as an employer, pay the $140 for my employee to be a member. Hey, we know you're taking 5 drugs. Look at the cost savings. If you'll get it from here, we'll pay the $140 membership fee for the year. And the employer wins, the employee wins, and now you're not forcing their hand, but you're giving them that avenue where it's less of a barrier to get with the employee. So that's something maybe we'll talk about. Is there a way we could bill? And I'm thinking out loud here. A way we can bill out, tell an employer, hey, you have 200 employees and 50 of them get their drugs from here. Can you guys just bill them $7,000?
Yeah, we're actually working on it. It's in development right now. Basically, so how the ScriptCo works right now, there's a login that is tied to a member that a credit card is put on file to bill the membership, and they can add as many credit cards as they want, but it pays for the membership and drugs via the member. So we're working on a platform that allows a company or sponsor, we're calling it corporate sponsor, to pay for a group or set group of employees membership, and that membership will be the name of the company or sponsor. And so it will be billed on a monthly basis for the membership, and then the actual patient will pay for their meds. So that's what we're working on, and having an enrollment process where it makes it simple for corporate sponsors, companies, i.e. whoever, to pay for a group of patients' memberships where it checks eligibility. They can send in FTP transfer files to de-enroll, enroll people, and we basically bill them on a monthly basis to save them money.
So you're on the right path. I mean, you answered everything I was thinking, and so you're already on the right path. I think that's fantastic.
The only reason we haven't done a monthly membership in the traditional consumer space is because people will get in, get a 90-day supply, get out, get in, get a 90-day supply, get out. Whereas on the employer side, it makes sense. It's like the employer's not going to do that, right? They're not going to play the game of trying to work the system and get 90-day supplies when they only pay for a month.
Yeah, right? They're not worried about saving $90 in the end. Yeah, exactly. I like it.
$20.
Yeah, I can see somebody dropping off too. I got my drug 90 days. Now they come back to you. Oh, I want to join again. Get 90 days and come back off.
And we don't want to do like a
cancellation
fee or a cancellation fee.
That'd be a billing nightmare for you guys too.
Yeah.
So we don't do that. We don't do cancellations, reactivation fees.
Yeah, that's why we only offer either a 90-day membership or a 365-day membership.
Yeah, right? I mean, you're looking at what, 200 versus 140.
Exactly.
I mean, again, why waste some of your RX savings on redoing every quarter?
Yeah, and the real reason we did the 50 was to give people the opportunity to try it, right? Without having a bigger commitment, right? So they can try it for 50. They can immediately switch to an annual membership in their patient portal, in their membership portal, and then the next time they get billed, they'll be billed for an annual membership instead of a quarterly.
That's outstanding. So, all right. So the next steps are you guys are going to, we're going to go the employer side, hopefully get that set up. Are you working with Pbms at all to see? It's like, I know we work with the Pbms. They have their own mail order. They have mail order companies they contract with. But I'm just thinking now from a PBM standpoint, if I'm a fiduciary PBM, I have no incentive. My only goal is to get the lowest cost drugs for our clients. So they're working with mail order doing that, but if the drugs are lower through you and you're a mail order, can you work within a PBM, a fiduciary PBM, not one of the big ones?
I think the only thing we want to stay away from is being forced to adjudicate a claim and send back data to a PBM, right? Okay. It's like, hey, how can we work together where it's like, I don't know if they have a portal, or we just don't want to create we don't want to disrupt our process right now because it's so efficient, right?
Yeah.
We're able to move so fast and fill meds without any headaches because it's doctor sent in lisinopril. It's a 90-day supply. Robot, fill lisinopril. File pops out. Lisinopril goes into the patient caddy, rolls down the conveyor belt. Pharmacist does final verification, rolls down the conveyor belt to shipping. It's boxed up and shipped. I mean, it's so fast.
This is awesome. So I'm excited to have you guys on here. This is just, I can't believe I just now learned about you guys, a couple months ago.
Yeah.
And then now you're everywhere on the news, and this is exciting.
Yeah, we got a long way to go. It's hard. We, like Zach said, we haven't advertised, and we're raising funds right now to market. So it's hard getting the word out to consumers. So we appreciate you having us.
Yeah, we'll push this out and definitely. And I think, a few things just to remind people. If you're taking generic drugs, 1 or 20 or 10, at least check out the pricing on ScriptCo. See if it makes sense to look at it, go further, try it out. Definitely, everyone should check out ScriptCo.com. I'm looking forward to it. I appreciate you guys coming in. This is awesome. And we're going to put some more samples up. We're going to be pushing this out all week because there's just, looking at the drug pricing, it drives me nuts.
Yeah, us too. That's why we did this.
So great. Zach, Mark, great to see you guys. Thanks for coming in. Thanks everyone for tuning in to the Ovation Show. We'd like to give special thanks to our supporters, Craig Shelley Luxury Watches and Fine Jewelry out of Beverly Hills, Success North Dallas, where Bill Wallace has been making connections for over 30 years, and Work Innovators, where they're amplifying the voice of business. And now a special word from our title sponsor.
Employers turn to TBX to provide a modern, seamless, and hassle-free self-enrollment experience for core and voluntary products aimed at educating, not selling to employees. In fact, not only can employers provide a user-friendly, mobile responsive technology solution full of dynamic communications, professional videos, and a data-driven decision support tool, they can do so at no cost to them. That's right, with TBX, there are no setup fees or PEPMs, and there's no need to replace existing technology, as we can easily snap onto any existing HRIS and HCM systems. Plus, the enrollment experience is ready in just 30 to 45 days or less, and data files are properly formatted and delivered to carrier and payroll destinations quickly, securely, and accurately. We look forward to helping you accomplish what others can't: a state-of-the-art technology platform for open enrollment, new hires, and qualified life event processing that's simple to implement and maintain. A partnership that's a perfect fit. That's TBX.